Dr. Leigh Erin Connealy emphasizes the immune system as a crucial surveillance and policing mechanism for the body, not just a defender against external pathogens. Its function is influenced heavily by environmental toxins, stress, electromagnetic fields, and chronic infections, all of which contribute to what she calls the Great Poisoning. These factors cumulatively weaken immune surveillance, allowing cellular dysfunction and diseases like cancer to develop. She underscores that most diseases, including cancer and chronic conditions, are related to immune system deterioration. Aging itself contributes to immune decline, which begins as early as age 30, increasing vulnerability to illness. Cancer is described by Dr. Connealy not as a sudden event, but a progressive, roughly 10-year process from cellular dysfunction to tumor formation. She critiques conventional cancer treatments, surgery, chemotherapy, radiation, for being damaging, inflammatory, and immunosuppressive. Instead, she advocates for an integrative approach that supports the patient's immune system while addressing cancer. The immune system's role includes identifying and eliminating abnormal cells, and its failure leads to cancer progression. Laboratory testing, such as Cyrex's Immune Function Panel, provides a deeper look at T cells, B cells, and natural killer cells to assess immune health and help guide personalized treatment. Dr. Connealy shares her personal journey from classical medical training at Chicago Medical School through her evolving interest in functional and integrative medicine. Early life experiences with toxins like DES, diethylstilbestrol, given to her mother, which caused hormone and cancer risks, motivated her to explore beyond traditional protocols. Her practice foundations shifted towards patient education, lifestyle interventions, and comprehensive lab assessments, departing from the disease-centered model of mainstream medicine to a health optimization model. She stresses a holistic view, incorporating emotional, spiritual, and musculoskeletal aspects, rather than merely treating symptoms or diseases in isolation. Her upbringing involved natural food consumption, including organ meats and fermented foods, grounding her appreciation for nutrition's role in health. She recounts an early experience as a medical resident where she improved childbirth practices by avoiding episiotomies through non-invasive support, highlighting her commitment to do no harm and patient-centered care. Encouraged by a mentor in the 1980s, she focused on lifestyle guidance, even before the concept became mainstream, teaching patients how to track diet, exercise, and monitor blood labs thoroughly. Her approach always includes individualized patient care rather than one-size-fits-all medicine. Supporting the immune system involves mindset and environment as much as physical interventions. A positive mental attitude and daily affirmations set the tone for immune resilience. Stress reduction is crucial since sympathetic nervous system activation raises cortisol and inflammation, which harm immunity. Grounding or earthing. Direct contact with the earth to discharge free radicals is emphasized as a low-tech but powerful method to restore cellular electrical balance. Nature immersion or forest bathing also boosts immune function through clean air, negative ions, and mental restoration. Supplementation includes thymus peptides, medicinal mushrooms like reishi and turkey tail, vitamins D and C, and bone marrow peptides to enhance immune regulation and longevity. Dr. Connealy sheds light on the often overlooked impact of electromagnetic fields from cell phones, Wi-Fi, 5G, and other technologies. These disrupt calcium ion channels in cell membranes, lowering cellular voltage and causing oxidative stress, inflammation, and mitochondrial dysfunction. She advises practical measures like reducing EMF exposure during sleep through use of Faraday cages, turning off bedroom electricity, and using protective phone cases. The cumulative, largely invisible damage caused by EMFs contributes to immune dysfunction and disease risk, including cancer. An important concept in Dr. Connealy's view is the cell's voltage and pH balance. Healthy cells maintain a slightly alkaline pH, 743, and generate energy efficiently via oxidative phosphorylation, the Krebs cycle. In cancer and other diseases, cells become acidic and rely on inefficient glycolysis, producing lactic acid and dropping cellular voltage. This loss of voltage impairs cellular metabolism and immune function. Restoring the body's natural voltage through lifestyle, such as grounding, sun exposure, clean air, and bioelectrical therapies, is critical for cancer prevention and health restoration. Devices like biomodulators and biochargers can support cellular energy and healing by delivering frequencies to optimize voltage. Prevention focuses on lowering toxic burden and maintaining robust cellular function. Detoxification practices include Epsom salt baths, infrared sauna, liver flushes, and fasting protocols adapted to individual tolerance. Dr. Connealy recognizes that chronic low-level toxin accumulation, not just acute toxic exposure, drives health decline. Real whole foods form the diet's base, prioritizing nutrient-dense animal products, organ meats, vegetables, fruits, and healthy fats, olive oil, butter, ghee, coconut oil, avocado. For certain cancers like brain or pancreatic cancer, ketogenic diets are used therapeutically to starve cancer cells by restricting glucose. She stresses tailoring diet and therapies to each patient's unique needs. The discussion references the Flexner Report of 1910, which standardized and centralized medical education in the U.S., steering it toward pharmaceutical and synthetic interventions favored by powerful industrial interests like Rockefeller. This shift marginalized holistic, compounded, and homeopathic approaches, branding them alternative and reinforcing a disease treatment model focused on drugs and surgery rather than prevention and wellness. Dr. Connealy critiques this medical-industrial complex and advocates for reclaiming a patient-empowered, comprehensive approach that blends conventional and functional medicine. Dr. Connealy's personal regimen includes a morning green juice enriched with antioxidants, regular weight training, sun exposure, affirmations, and team collaboration in patient care. Evening routines emphasize breathwork and relaxation to reset the nervous system and optimize sleep. Supplements for sleep include magnesium, melatonin, pancreatic enzymes, and progesterone. Hydrogen water is favored for its anti-inflammatory and antioxidant benefits. She views self-care not as indulgence, but essential health care, particularly for caregivers who often neglect their own needs. Preparing for restorative sleep is foundational since restoration happens during this phase. Her philosophy toward cancer care integrates traditional and advanced diagnostics beyond standard screenings like mammograms or colonoscopies. Early detection includes comprehensive lab and imaging panels. Treatment prioritizes immune preservation, detoxification, hormonal balance, and voltage restoration, combined when necessary with conventional interventions, but always buffered with supportive care. Dr. Connealy underscores the need to care for the whole person, not just the cancer, focusing on healing the host while eradicating tumors, thus improving outcomes and quality of life across all cancer stages. The notion of mindset as foundational to health recurs. Dr. Connealy describes an ultimate human as someone living in equanimity, balanced, peaceful, and harmonious despite life's challenges. Operating from this calm centeredness shapes how one reacts to stressors, maintains immune function, and navigates life's demands with resilience and grace. This mental and emotional well-being is as vital as physical health in her integrated model of longevity and disease prevention. Connealy's clinical practice, the Cancer Center for Healing in Irvine, California, offers integrative treatment and accepts patients across all cancer stages, with a preference for early intervention and prevention. She provides education through books and social media, supporting those seeking a functional and holistic approach. Her online presence includes Instagram and informational websites where people can learn more about immune optimization, cancer prevention, and whole-person care.